Hey 5202, this week we're talking about one of my favorite subjects, interprofessional education. But since this is a stressful time, due to increased workloads, children home from school, people hoarding toilet paper, and we're going to make this video a little bit lighter and have story time with Rachel. So throughout this video, I'm going to be sharing some of my experiences with interprofessional education, or IPE, from both an educator and a learner's perspective. And I'm really excited about this module because IPE is why I went into educational research in the first place. As I mentioned in my introduction video, I went into research because I took an IPE class in my master's degree, and in short, I thought the subject was really cool. A lot of the things that I had experienced in my own nursing education were things that were coming up in the class, and I really wanted to investigate further. In particular, I was really interested in some of the more sociological aspects of interprofessional education, such as power dynamics and hierarchy. So I ended up doing my final practicum placement on IPE research within health professions education, and 7 years later, here we are. But enough of my ramblings, let's get into it. So I guess we really should start off with what is IPE. Most of us are well aware healthcare professionals are typically taught separately from one another or in silos, despite somehow being expected to magically work together flawlessly upon graduation. Yeah, that doesn't happen. So IPE is really meant to be a way of kind of trying to break down these professional silos. In short, IPE is often described as when two or more healthcare professionals learn with, from, and about one another. In your required reading this week, the article offered a more comprehensive definition of IPE. An IPE intervention occurs when members of more than one health or social care, or both, profession learn interactively from each other for the explicit purpose of improving interprofessional collaboration or the health and well-being, or both, of the patient or clients. Within education more broadly, we can understand IPE as occasions when two or more professions learn with, from, and about each other to improve the quality of students' education. So there's some commonalities that we can take away from these different definitions of IPE. First, IPE needs to involve more than one profession. The learning process between different professions needs to be interactive. And the final two definitions have a real focus on improving outcomes for the population that's being served, whether it be patients or students. You've probably heard a lot of different terms used to describe IPE or similar concepts. Even in some of the articles we've read this semester, we've seen a variety of different terms being used. For example, you may hear multi-professional, interprofessional, multidisciplinary, interdisciplinary. So are these the same thing? In short, no, but they are often conflated. Here's a little flowchart I put together to explain interprofessional collaboration while I was teaching community health nursing at Ryerson University. First, you want to consider how many professional or disciplinary groups there are. If there's only one, it's intraprofessional. Or you may also hear the terms uniprofessional, although that's not as common, and I also recently saw monoprofessional somewhere. Then you want to consider how they're solving the problems or providing services, or in our case, how they're learning. If it's collaboratively, we use the prefix inter, and if it's separately, we use the prefix multi. And then we need to consider if the group is composed of different disciplines or different health and or social care professionals. My prof for my IPE course liked to use a fruit salad metaphor. So when it's interprofessional, it's kind of like a smoothie. Everyone's blended together. Whereas when it's multi-professional, it's like a fruit salad. Everything's kind of mixed together, but you can still pick out each individual professional. And that reminds me of a story. Welcome, everybody, to Storytime with Rachel, where we're going to be spilling the tea on IPE. I really wish I had a classier armchair for this, but this will have to do. So several years ago, I attended the Canadian Burn Symposium, and this is an interprofessional conference that, as the name very much suggests, is about burn care. And this was the first year that they were also going to be having first responders. So it sounds great, right? Yeah, I guess, but I mean, it really wasn't aligning with the definition of interprofessional education. So at the beginning of the conference, I went to the sessions that were meant for more hospital-based care providers, so physicians, surgeons, nurses, and it was fairly didactic, and at least in the sessions that I attended, there wasn't a whole lot of interaction between the different groups. But more concerning was the fact that the first responders were running their own completely separate program from everybody else. So while nurses and physicians were in one hall, first responders were often in an entirely separate room altogether. So not a whole lot of collaboration going on there. But I do think this was a huge loss from an educational standpoint. I actually found the first responder sessions I attended to be very powerful, so after attending one, I ended up skipping all the ones that were meant for nurses, and I just went to all the first responders programming, despite the fact that I am not a first responder. So while I had a great IPE experience because I chose to go to the first responders program, I would argue that the conference in and of itself wasn't particularly interprofessional. So the variation in terminology here matters because it makes things a little complicated for educational researchers and educators. This is because it makes it challenging for researchers and educators to interpret evidence and to evaluate interventions. Think about it. How difficult is it for you as an educator to determine if a certain educational intervention is going to be effective if everyone's using completely different terms to describe that same intervention? It makes doing lit searches real difficult. And specifically to IPE, all these different and very sometimes ambiguous terminology and definitions makes it really difficult for us to establish a lot of robust evidence for the effectiveness of IPE. These concerns about inconsistent and unstandardized terminology within continuing education is actually why your foundational article this week was written in the first place. It was part of a larger project where we were developing a methodology to clarify different terminology used in continuing education. We then also applied this methodology to 4 different educational interventions, including performance measurement and feedback, practice facilitation, educational meetings, and of course, IPE. So why do IPE? With regards to healthcare, as we know, patient care is very complex. It often relies on interprofessional collaboration because no one profession on its own could meet all of these needs. IPE has also been described as getting graduates ready to face the realities of clinical practice, giving them the skills and attitudes that they're going to need to communicate with other professions, to collaborate with other professions, and problem solve with other professions. It also strives to improve professionals' understanding of other scopes of practice. And as I've alluded to earlier, one of the other goals is to try to break down professional silos, as well as challenge some of the stereotypes we may hold of one another. Many people would argue that stereotypes in and of themselves aren't necessarily a bad thing, but they can be very negative when these stereotypes are rooted in very inaccurate beliefs. Within interprofessional work, these stereotypes can hinder our communications and collaboration. So take a moment to reflect on some of the stereotypes of your own profession. Do you find them to be accurate? Useful? My own professional background, which is nursing, has no shortage of stereotypes. There's the ministering angel, the naughty nurse, doctor's handmaiden. These are neither accurate nor particularly useful stereotypes of nursing. And that actually reminds me of a time that IPE changed my understanding and my stereotypes of a profession. So back to the Byrne Symposium. So as I alluded to earlier, I found the first responders programming at this conference to be extremely life-changing and powerful for me personally. And this was for many reasons. For one, I got to hear more about pre-hospital care, which is really something that wasn't discussed at all, arguably, actually, in my nursing training. And then for some of the sessions, it was firefighters talking about their own stories with receiving horrific burns on the job, and then in some cases losing their colleagues in the line of work. Another thing I gained an appreciation for was the deep level of teamwork and commitment to their partners that they have within first responder culture. And I think the rest of us in healthcare could really learn from that. And another benefit for me of attending this interprofessional session was that it really challenged some of the stereotypes that I had about first responders, some of which I didn't even realize I held. When I used to work as a lifeguard, putting myself through nursing school, we were right across the street from a fire hall, and a lot of times some of the firefighters would come over and work out in our gym, particularly the prospective firefighters who were not yet firefighters but wanted to be firefighters. And a lot of times they would just be lifting weights that were way too heavy for them, and they would get one rep and then drop it and, start swearing and fist bumping each other. And without even realizing this had somewhat negatively impacted my stereotypical notion of what a firefighter is. However, attending this session made me a lot more cognizant of the scope of the work they do and their training, and made me a lot more empathetic towards some of the challenges that they face in the field. And over lunch, one of those, informal learning moments, I ended up sitting with the firefighters and they were talking about some of these stereotypes with me and how they are perceived by people. And they talked a little bit about working out. And one of the guys told me why they work out so much is really for the safety of their partner, because they always need to have the strength to be able to physically lift one another. And he said that if his partner was ever to be injured or, God forbid, killed on the job, he explained that he would be the one going to talk to his partner's family and his wife And he said he felt like he needed to be able to tell his partner's family that he did everything that he could to save him. So skipping a day at the gym was not an option. And for me, at least, this really challenged some of my stereotypes that I had about firefighters. Now, what do stereotypes actually mean for health professions education? Well, some studies have shown that as early as 2 months into a health or social care professional's training, they've already developed some pretty strong stereotypical notions not only of their own profession, but also of other professions. And within this, they sometimes also have a very strong understanding of what their social status is going to be compared to other professions they're working with. And a 2014 systematic review also found that healthcare students hold both positive and negative stereotypes of other health and social care students and professions, which may be present when students first enter professional healthcare education. And this may impact their communication and their collaboration within both their training and beyond in their practice. So what does this actually mean for us as educators? Well, before I go into some tips that I have for you guys, I want you to reflect on a few things. First, what are some things that you think you need to keep in mind when you're planning IPE activities? Who might you want to involve? And what are some of the challenges or barriers you think you may face? So here's a few tips and considerations I have for you with regards to IPE. First thing you want to do is assemble your interprofessional team. As the Van Hoof article states, we do want to make sure that we have an interprofessional team for both planning our IPE activities as well as implementing them. And I would also add that you want to make sure everyone is meaningfully involved. In the past, in my own experiences, sometimes I get put on teams as kind of a token nurse. Another thing you can do is you can do some networking to find others who you can develop IPE activities with. This may be an existing IPE team that you can join. It may also be beneficial to observe how others facilitate IPE classes if you're new to this kind of work. The next thing to consider is actually picking your topic. So like the Van Hoof article talked about, we want to make sure our IPE activities focus on common educational needs, such as teamwork, collaboration, coordination, communication, role understanding, in service of high-quality patient care, or high-quality teaching for those of you in education. So when picking your topics for IPE, consider real-world situations that your learners may find themselves in their clinical practice. You may also want to consider issues that are very topical. There also may already be teaching materials on a topic that you can adopt. Make sure you don't go crazy with how many different professions you're including in your IPE activity. Realistically, you can't include everyone. Some people suggest that focusing more on about maybe 4 to 5 is more realistic. You also want to make sure the group isn't dramatically unbalanced. So for example, you don't want to have a group with like 15 nurses, 1 physician, and a social worker. Another consideration is timing. So one thing you want to consider here is where the learners are at in their training, because different professions may focus on different issues in different years of their training. You also want to make sure IPE is going to be an ongoing thing. So we do want to try and target them earlier in their training, but we also want this to be an ongoing thing that they do throughout their professional development. Another thing you want to consider is making sure that whatever it is you're planning is actually IPE. So IPE isn't supposed to be just a bunch of different professions sitting in a room listening to the same lecture. It's meant to be highly interactive. As we talked about with the definitions, it's supposed to be learning with, from, and about one another. So you need to make sure they're all actually interacting with one another. Another thing you can do to help with interaction is make time for breaks where they can get to know each other on a more informal level. Consider your resources. So you may want to start smaller, a little more low-tech, low-cost. A lot of institutions don't have a lot of funding for IPE, so you may need to prove that it's effective before you can get more funding. And another major consideration is managing professional identities and tensions during your facilitation. So as educators, you're going to have to help your learners manage their own professional identities. For example, helping them understand professional boundaries and what they're able to contribute to an interprofessional team. But you also want to make sure these professional boundaries don't become professional barriers, and you want to make sure that they don't feel like their profession is being threatened by the IPE activity. This is going to be a time where a lot of the stereotypes, hierarchy, and power imbalances are going to be challenged, for better or for worse. And you're going to need to be able to manage this tension as an educator. One of the ways I like to kind of manage this and help my students build some rapport when it's an interprofessional group is getting them to go around when we're doing our introductions and getting them to not only introduce their name and their profession, but why they chose that profession specifically. Very similar to the word cloud activity that our games and creativity group did. I found a lot of time my groups were really shocked when they realized that there was so much overlap and similarity between why different people chose totally different professions. For example, one time I had a physician and a social worker describe very, very similar reasons for why they chose their profession specifically. and that really surprised a lot of the students. And I found this really helped bring my groups together and helped build that kind of rapport before we really delved into the topic. Although sometimes this didn't actually work. One time I had a medical and a dentistry student really going at it for the entire workshop, and that was a lot of fun to facilitate as an educator. So to link this all back to teaching strategies, after all, this is a teaching strategies course. So in your own experiences with IPE, what kind of teaching strategies have you seen used? And thinking back over the previous weeks, which teaching strategies do you think are well suited for interprofessional education activities? Personally, I can't really think of a teaching strategy that wouldn't work for IPE. Granted, it may be a little bit more difficult with a really didactic lecture, but there are ways around that. And realistically, as long as you're involving multiple professions and you're making sure there's that interaction between the different groups, you have IPE. Within the literature, it is extremely common to see simulation and IPE put together, as we saw with 2 of our readings this week. And some other strategies I've seen within the literature include reflective learning, experiential learning, case-based learning, lectures, and e-learning. However, sometimes when you're looking at these different review articles, when they're talking about these different teaching strategies, it can be a little difficult to figure out what teaching strategy exactly it was. And this is largely due to that inconsistent and unstandardized terminology issue we discussed earlier. For example, one of the articles I was looking at used the terms small group work or team building exercise. Well, as an educator, what does this actually mean? Could small group work actually be PBL? Was it reflective learning? Experiential learning? I don't know. And that's all for now, folks. I hope you found this video both educational and entertaining. And as always, Helga and I will see you online.